The next part of lecture is caries of enamel, superficial caries. It's also caries of enamel, but with the damage of enamel. It also corresponds to the code K02.0, but it is called superficial caries, caries of enamel. There is destruction of the surface layer of enamel and the depth of the defect to the enamel dentin border. Till border, not penetrate to the dentin, only in the enamel. Pathological anatomy of superficial caries. There are some area of decay according to Gustafsson. There are 5 zones. First zone of hypermineralization, next first zone of hypomineralization, and again second zone of hypermineralization and second zone hypomineralization, and the last one zone of decay. Clinical manifestation of superficial caries. There are also basic and additional methods. As for basic methods, during complaints we find out that sometimes there are no complaints, or it may be also pain from chemical irritants, more often from temperature or maybe from sweat. And also patient may have complaints on aesthetic defect. Next, inspection. We may find out change the color of the affected area, also defect localization, and detect presence of dental plaque. During probing, we found roughness of or caries in the enamel, and it may be painless or slightly more painful, but slightly, not sharp painful. Maybe painless, maybe slightly painful. And as for percussion, it is always painless. Additional methods during superficial caries. Thermometry. It may be painful but short term, not long. Very short term. Painful short term. Electroodonto diagnostic is standard like a healthy tooth, from 2 till 6 microampere in the front and from 2 till 20 microampere in the molars, for example molars. Laser flowmetry has indicators between 10 and 25 points. During X-ray diagnostic, we detect cavity K1 or K2 in the enamel more than 1, or the whole enamel but not penetrating into the dentin. K1 till half of the thickness of enamel, or K2 in the enamel the whole layer of enamel but not in the dentin. Differential diagnosis of superficial caries. There are 3 diseases which are similar to superficial caries, that is why we have to differ them. First one is enamel hyperplasia. Enamel hyperplasia has smooth surface and symmetrical teeth are affected. Look like this. Next one, erosion of enamel. The cavity during erosion have the cup-shaped form of cup. Also, they have smooth bottom. They are brilliant and hypersensitivity. And the third disease is wedge-shaped defect. And it's easy, it has wedge shape, smooth surface. The treatment of superficial caries. First option is polishing plus remineralization therapy. It's not typical, it's very rare option. More often we use preparation and filling. So, the treatment of superficial caries, more often formation of caries cavity with subsequent sealing. And as a filling materials, we use composites, glass ionomer cements or compomers. Preparation of caries cavity and filling. And the lecture is over. Thank you.